We have presented data here at the iwCLL workshop in 2023 about real-world evidence data about the use of first and second generation BTK inhibitors in patients with CLL. What we have seen is that the efficacy data is almost the same as the data that we have seen previously reported in clinical trials, and we have not seen any other significant safety signals when having a longer follow-up than those published in the clinical trials. What we have seen in Spain is that the treatment pattern is a bit different between the two different BTKIs that we have in our country. We saw that Ibrutinib was more commonly used in the last 5-6 years because it was first approved in Spain, and in most of the cases it has been used in a relapsed refractory setting, while second generation such as Acalabrutinib is more commonly used in first line. With regard of efficacy, we didn't see any differences between them, as the trials that have been published a few years ago. And with regards of safety, we have only seen differences with regards of hypertension. So patients treated with Ibrutinib are more likely to have high blood pressure figures than those patients treated with Acalabrutinib. And we didn't see any differences with regards of other cardiovascular toxicities such as atrial fibrillation or other arrhythmias. So at the end, we can conclude that despite our patients in the real world practice, probably most of them were not eligible to participate in the trials, the outcome is going to be almost the same as the data published in the clinical trials.